طيب بسم الله الرحمن الرحيم. We are going to present 3 cases today. Communication skills, history taking, station 5. We'll start with communication skills. Dr. May Ali, we promised you last time to present a case today. You are ready?
Okay, Dr. Saab.
Mr. Jack is 48 years old man who is a company director, has recently undergone a routine employment medical investigation that has revealed glucosuria, no ketones. A subsequent fasting glucose level is 12 millimole per liter. He smokes 20 cigarettes per day, watches a lot of football matches, and is obese. He has been referred to a new patient diabetic clinic for further advice and management. Please discuss the result with him.
نعم دكتور صادق ثاني السيناريو.
Again, Mr. Jack is 48 years old man who is a company director, has recently undergone a routine employment medical investigation that has revealed glucosuria, no ketones. A subsequent fasting glucose is 12 millimole per liter. He smokes 20 cigarettes per day, watches a lot of football matches, and he is obese. He has been referred to a new patient diabetic clinic for further advice and management. Please discuss the results with him. You have 3 minutes to write the headlines of your case before going to your station in the white paper. Of course, as we discussed before, the 5 minutes before going to your station is the most important 5 minutes at the exam to prepare yourself and to write the headlines you are going to discuss with the patient and to arrange your thoughts, what you are going to discuss with the patient, not to forget something important. Again, the scenario for Dr. Sana, she just joined us. Communication skills. Mr. Jack is 48 years old man who is a company director, has recently undergone a routine employment medical investigation that revealed glycosuria, no ketones. A subsequent fasting glucose is 12 millimole per liter. He smokes 20 cigarettes per day, watches a lot of football matches, and he is obese. He has been referred to a new patient diabetic clinic for further advice and management. Please discuss the results with him. Counseling for chronic illness.
His name, Dr. Sadiq.
Okay, we can start. Time. Okay.
What is the name of the patient?
Mr. Jack.
Okay. Good evening.
Good evening, doctor.
Okay, I'm Dr. Umays in House of Science Medical Clinic. Nice to meet you.
Nice to meet you, doctor.
First, I want to confirm that you are Mr. Jack, 48 years old. That is right?
Yes, doctor.
Okay, we are here today to discuss some issue related to your health. That is okay with you?
Yes, I'm coming today to know the results, doctor.
Okay. First, I want to know, how do you feel now, Mr. Jack?
I feel okay, doctor. I didn't feel any complaint previously, actually. I did some routine investigation for my employment. And they told me that I have
Okay.
some glucose in my urine, and they told me that my glucose level in the blood is high, doctor.
Okay. As a routine investigation done for you and some subsequent blood testing done, it shows that you have a high level of the blood sugar in your blood. That is a condition which is called diabetes mellitus.
I have diabetes, doctor. Does this investigation mean that I have diabetes?
Yes, Mr. Jack.
How can, doctor?
Because
There is no member of my family has diabetes at all.
Yes, sometimes this disease, it could not run in the family. It come as a sporadic case. And the result, the investigation which is done for you, it shows that you have a high level of this blood glucose. That
Yes,
is done
doctor.
in subsequent manner for you. How do you feel about that?
I'm shocked, doctor, regarding this results. I didn't feel anything at all before. I just made some routine investigation for my employment, and you're saying for me that I have diabetes now.
Okay. Can you tell me, what do you know about the diabetes mellitus?
I know it is a long-standing disease, doctor, and I know it has a lot of complications. That's all what I know.
Okay, if you allow me, I can explain more about this disease if you don't mind.
Yes, doctor.
Okay, if I will draw for you, there is a gland in the tummy which is called pancreas. This gland secretes a hormone or a protein which is called insulin. Sometimes this protein, it will be deficient from the body. This protein leads to control of metabolics in the body, especially how to deal with sugar. As a result of this deficiency of this hormone, the level of the glucose will increase in the blood. As a result of that, it affects many systems in the body. This high blood glucose can affect the heart, can affect the nervous system, it can affect the kidney, affect any system in the body, even the peripheral nerves. It leads to, as I said, to many complications if you are not adherent to the medication. Are you with me, Mr. Jack?
Just 1 minute, ممكن دكتورة, I will excuse the group just 1 minute for to reply this call. Yes, okay. Go on, doctor.
Okay. Okay, this hormone or protein is called insulin. As I said to you, it controls the metabolism of the body, especially how to deal with glucose. In a case with this protein is deficient, lead to increase of this blood glucose and lead to more complication in, as I said to you, in multi-system in your body. It can affect the eyes, it can affect the nervous system, it can affect the kidney, it can affect the heart, it can affect the peripheral nerves. That is why we should deal with this condition to help you not to complain from this complication in future. Are you with me, Mr. Jack?
Yes, doctor.
Okay. Regarding this condition, some person may suffering from symptoms like feeling thirst, sometimes increase the amount of water work, sometimes it lead to affect his eyes, a little disturbance with the vision. Sometimes disturb, as I said to you, the peripheral nerves lead to pain and numbness. It can also affect the heart with susceptibility of heart attack. But fortunately, you said to me that you have no any complaint. Is that right?
Yes, doctor.
Okay. If you don't mind, can you allow me to talk about how to resolve this problem?
Yes, doctor.
Okay. Regarding the management of this condition, this needs a multidisciplinary team. First of all, I want to refer you to the endocrinology doctor, that is gland doctor, dealing with this condition, to help to give you a medicine to control your blood glucose. First, we trying this oral medicine and follow you in the clinic, in the gland clinic of doctor. If your blood glucose is become controlled, that is okay. According to the reading, they can increase or modify the medication accordingly. Are you with me, Mr. Jack?
Yes, doctor.
Okay. Regarding also, I will refer you because your body weight is seems to be high. I want to ask you, do you recently lose any weight?
No, doctor, I have this weight gain for a long time before.
Okay. Also, I want to advise you that I will refer you to dietitian doctor to help you to lose the weight, because losing of this weight will help you to control your blood glucose.
If I lost my weight, doctor, my
I want to
diabetes
ask.
can be cured?
It may be cured if you lose the weight, and accordingly, it may be cured or not cured. That is why you should be followed by the gland doctor and the dietitian doctor.
Yes, doctor.
Also, I want to ask you, what about your exercise?
Actually, doctor, I don't do exercise. You know, I'm lazy in this point. I used to watch a lot of football matches, but I don't play, and I'm not doing exercise regularly, doctor.
Okay, if you don't mind, I can refer you to exercising program to help you regarding this issue, because also adherence to exercising can also improve your blood glucose. That it should be adherent to this exercising program, like walking about 3 to 4 times per week. That is okay with you?
Yes, doctor.
Okay, may I ask you, what about your diet?
I eat 3 diets per day, doctor, and I eat so much. That's why I'm obese.
Can you tell me what is the consistency of this diet?
Everything, doctor. I eat everything.
Okay. with patient who has been diagnosed as diabetes, you should be adherent to special type of food that is with decreased amount of carbohydrate, but increase in the other minerals and protein. Also decrease amount of fat also, because fatty food will lead to increase of the lipid profile. That is with diabetes lead to affect more your health and put your health in a danger. Did you ever check your lipid profile, Mr. Jack?
No, doctor.
Okay. We will arrange for you to check your lipid profile, and also we refer you to dietitian doctor to give you more advice about the diet that you should be adherent to it. Mr. Jack, I want also to ask you, are you smoke?
Yes, I smoke 20 cigarettes per day, doctor.
For how long?
For the last 20 years.
Okay. Did you ever have any idea to quit the smoking?
No, doctor, I enjoy smoking so much. I didn't think to give up.
Okay. If you don't mind, I will refer you also to smoking cessation clinic to help you to stop smoking, because smoking, in addition to your diabetes, also will affect your heart and increase a condition of heart attack. That's okay with you?
Yes, doctor.
Okay. Mr. Jaga, do you drink alcohol?
No, doctor.
Okay. May I know what is your job?
Yes, doctor. I'm a company director, doctor.
Okay, and you tell me you have no other, no any complaint?
No.
Okay, Mr. Jack, may I know what is your concern?
Yes, doctor. There is no cure for this disease, doctor. I have to take my medication forever.
Well, Mr. Jack, I will tell you that because you are obese, if you lose weight, and we follow you in the clinic of the gland doctor, sometime if you lose weight, the result of blood glucose will return back to the normal. Especially you are not suffering from any complaint of the diabetes, like like increase thirsty or increase amount of your urine, or you are not losing weight. And sometimes this condition will continue for long time. I'm sorry to tell you that you should be adherent to the medicine. Also, you should be, I will refer you to the eye doctor to check your eyes.
Is it injection, doctor, or oral medications?
First, we started with oral medicine, and we follow your blood glucose, and which we call hemoglobin A1C. That is reflects your control of blood glucose in the blood. And during follow-up with losing of your weight, if you found that your blood glucose returning to the normal, you can follow you without medicine. But if your condition is deteriorated and your blood glucose is not controlled, you can shift it to the insulin later on. That is okay with you?
Yes.
Okay, do you have any other concern?
Yes, I'm driving, doctor. This my diabetes can affect driving. I have to stop driving or what?
in a time being, because you are not complaining from any symptom regarding blurring of vision, you should be followed by the eye doctor first, and to see that if you have any problem, later on we can advise you to inform DVLA about your condition.
Yes, doctor.
Okay. Okay. Do you have any other concern, Mr. Jack?
No, thank you, doctor.
Okay. Let us to sum what which we are talking today. That you are Mr. Jack, 48 years old. Came for routine check of your blood. It found that you have high glucose in your urine, and your fasting blood glucose is shown to be high. You are a heavy smoker. And it shows that you have a condition which is called diabetes mellitus. I give you a hint about the disease, the complication and the symptom of the disease. I will arrange with you multidisciplinary team with the gland doctor, with dietitian doctor, and with exercise program.
Time finished.
And the smoking cessation clinic.
Okay.
Okay.
Come on. Okay. Okay. So, okay, doctor. Thank you. Okay, open
Thank
discussion
you.
about this case. Anyone has any comment?
Yes, Dr. Sadiq. Yes, Dr. Sadiq, please. Yes. Yes.
Dr. Mima.
Yes, Dr. Sadiq.
Dr. Magid.
Magid, Dr. Magid. Yes, Dr. Sadiq, please. Dr. Sadiq, this. Yes, thank you. Dr. Sadiq, this case has, without any symptoms like polyuria, polydipsia, I think better to give him a chance to lose body weight first before starting the oral medication. Right? And make another fasting blood glucose. I think diagnosis of diabetes without symptoms, we need two investigations, two fasting blood glucose. Separated two fasting blood glucose if patient without symptoms. But if he has symptoms like polyuria or polydipsia, diabetes can be diagnosed from the first high blood glucose.
I agree with you, Dr. Magid. The diagnostic criteria for diabetes can be two measures: more than 12 postprandial, or more than 7.1 or 7 fasting, or one reading with symptoms. Like in the presence of glycosuria also the risk of glycosuria, and the presence of high glucose level diagnostic also.
Yes. Second point, Dr. Sadiq, please.
Okay.
Okay. Second point.
Dr. Magid, تفضل.
Dr. Sadiq, this case exploration of chronic disease, so we can tell the patient if he needs someone of his family to attend this meeting. Better to tell him like this.
Yes.
Okay. Another point.
Any other point?
Yes. Yes.
Yes.
I think we have to tell patients. That he must make a annually follow up for his eyes, for fundoscopy and urinary proteins annually for checkup of his kidney function and retina. Is that okay?
Okay. Any other comments?
أيوة دكتور صادق. ألو. I think يا فندم دكتورة gives the patient many information in description of disease. She tell him many jargon about metabolism, about lipid profile. I think if she tell him you have a high blood sugar, this may be due to dysfunction or impaired function of your pancreas. Just a general view. She go in details. I think she gives the patient more information. And the second point, she must tell him about this disease is chronic disease. It is not curable disease. We can't control this disease like that.
There is point in most of the cases not to push a lot of information to the patient. Long-standing disease, chronic disease, long-standing disease. Chronic is considered to be jargon as well. So it's a long-standing disease.
Yes. Understanding disease, and she is, and I think this patient will refer to internist. No need to endocrinology, and she tell him, I will refer you to gland doctor. I don't know. The diabetic patient will refer to internist doctor. Internal medicine can treat this patient. And I don't know what's the rule. And if she is including internist and gland doctor, and I think if she is a doctor in internal medicine unit, she can treat. She can start to giving him plan of management.
And he is one of the multidisciplinary team would be involved in the case.
Yes. I think also she not ask him about any family history. I don't know.
Family history. He denied.
He told her that he has no family.
From the first, it is that he has no family history.
No, Beshan is the one he told, and he told that there is no family history.
Yeah, he told that.
Yes. Okay. Means.
Okay, Dr. Saleh, I have to do something queries. Actually, initially, as one brother, he said that he has that any chronic disease or breaking bad news, we should ask whether he want to involve anybody. Number one. Number two, we should ask about what is his idea. Breaking bad news, Dr. didn't put any pause, or what is his expectation, and I'm sorry. I'm really sorry. I feel that decrease empathy and more information.
We mentioned before, and I wrote in the page that don't get breaking bad news and counseling for chronic illness. Some sentences like, I'm really sorry for you for this bad news. Be sure that we are mentioning you as much as we can. How do you feel now regarding that? Dr. Amani, she didn't mention any of these sentences, and these sentences are important in counseling for medical chronic illness or breaking bad news, sympathy and the empathy. Okay. Okay, so let us organize what we are going to discuss in this case and what we are going to write in our white paper.
Dr. Saleh.
Okay, Dr. Ashraf.
الدكتوره مي هي عملت المانجمنت بلان كويس، بس يعني كانت حاسه انها تفهمهم ان في فارماكولوجيكال management plan and pharmacological management plan, and to emphasize that the non-pharmacological is as important as the pharmacological plan. The non-pharmacological can include the exercise program, the loss of body weight, smoking cessation, and awareness of stressful condition. And the pharmacological, he will be treated with the multidisciplinary team, and they will explain the oral hypoglycemic graphs
and the need of, and he may need lower doses if he adherent to this non-pharmacological plan. And the complication also of diabetes, she has to give an idea about the complication of oral hypoglycemics, which is hypoglycemia. Hypoglycemia is a very important issue we'll speak about in this scenario.
Yeah.
If you don't mind this.
Yes, I agree with you. Dr. May,
Otherwise,
already the lifestyle, medication of lifestyle regarding smoking,
yes,
and diet,
yes,
and exercise program. She discussed all of these areas. And regarding the pharmacological treatment, she discussed regarding weight loss also as non-pharmacological, and this is the main our target here. And this is the cornerstone here of the treatment to loss of weight. Diet pharmacological, she didn't mention that it will be oral treatment, and these oral treatment has some complications in the form of hypoglycemia sometimes, so that the diet and treatment has to be balanced to avoid such these complications. I agree with you.
Thank you, Dr.
Okay, so we'll write and organize our thoughts before going to the station in the 5 minutes by writing and write. Check handles, introduce myself, check the patient identity, check how much the patient know about this condition, check the patient want us to attend the discussion. Check the expectation of the patient regarding investigations, and then going to the main core of our station. Explanation that the patient has diabetes mellitus in gradual manner, and what's diabetes mellitus? Simple way, avoid jargon, and don't push a lot of information to the patient unneeded. Then complications of diabetes mellitus on the long run. Then the treatment plan of diabetes mellitus. And write the treatment plan, draw 2 lines. Not, like Dr. Ashraf said, non-pharmacological and pharmacological. Non-pharmacological, lifestyle modification regarding diet, weight loss, smoking, exercise program, and then pharmacological treatment in the form of oral treatment and regular follow-up. And don't forget to involve the patient in multidisciplinary team, including diabetic specialist, nurse, dietitian, ophthalmologist, and maybe nephrologist also, for regular follow-up of hair, eye, and hair kidney function, because they may be affected. Like that, and then summary, check understanding. طبعا don't forget concern, summary, check understanding and help for the patient. Like that, you draw the main skeleton you are going to discuss with the patient, not to forget anything at all. Dr. May, actually she covered most of the case, all of the case regarding what's diabetes, but she said to the patient that he has the pancreas is an organ secreting insulin, and maybe the insulin is deficient, but this is type 2, Dr. May, so it's type 2 diabetes. The problem not in the insulin itself, the problem is in sensitivity of receptors. So you explained already type 1, not type 2. And she discussed all the complications of long-term diabetes, eye complications, cardiovascular regarding hypertension and the heart problem, kidney, and the peripheral nerves, pins and needles. Then she explained for him the management plan in the form of lifestyle modification for weight loss, diet, exercise program, smoking. Then she will involve the patient in multidisciplinary team involving the nurse specialist, diabetic specialist nurse, and dietitian, and ophthalmologist, and also kidney doctor for regular follow-up for complication of diabetes. I'm really sorry for these bad news. I appreciate your feelings. Be sure that we are here to help you as much as we can, and be sure that your lifestyle and you can live normal life if you control your diabetes, and you can avoid complication if you are completely adherent to the medication, and with regular follow-up with the outpatient clinic. Regarding the driving, if the patient develop hypoglycemic attacks, at that time he can be forbidden from driving. And if the patient rise to some limit or to extend limit, maybe at that time he can be forbidden from driving. At the time being, you can drive with no problem at all. But if you develop the hypoglycemic attacks, at that time we will refer you to DVLA team because you may at that time it is risky to drive on yourself and for the other and for the public health. And summary, يعني very focused summary, and check understanding and give help for the patient. Leaflets, websites about the risk to know more about it. Your contact number as well. And it's better also in counseling for chronic illness to ask the patient anyone to drive you home. لكن بالنسبة بس الحاجات اللي احنا بننساها الامباسي والسيمباسي, the sentences we mentioned يا جماعة يعني are very important for empathy and sympathy. Don't deal with the patient like a machine. So empathy and sympathy and these sentences are very important. Okay, any other comment for this case? No, it is a straightforward case actually. If given the exam, the candidate should be lucky. Okay, the next case would be history taking. By Dr. Wael Said. We promised him before. Dr. Wael.
اوكي دكتور صادق, ايوه معاك.
Okay.
بس الكانديديتس يعملوا ميوت للمايك عشان في كوز كتير قوي.
خلاص لو نعمل mute المايكس only the one who is going to present to open the mic. Mr. Jack is 32 years old. He has been complaining of dry cough and shortness of breath for the last 1 week. 2 weeks back, he had a chicken pox, history with chicken pox, which is completely cured for your kind care.
دكتور صادق, ممكن بس the name of the patient?
Again, Mr. Jack has history of dry cough and shortness of breath.
Jack.
For the last
Jack.
week.
Okay.
He had history of chicken pox 2 weeks back, which completely cured for your kind care. You have 3 minutes to prepare your differential diagnosis and to write what you are going to discuss with the patient in your work paper. دكتور شادي كمان منورنا. دكتور شادي من زمان ما حضرش معانا.
نورك يا دكتور صادق.
دكتورة مروة من زمان برضه ما عملتش برزنتيشن. عايزين تعمل برزنتيشن معانا المرات الجاية إن شاء الله. الدكتورة نهى برضه
إن شاء الله دكتور.
دكتورة نهى تحبي يا دكتورة نهى تعملي ولا لسه شوية؟
ستيشن 5 يعني بلاش نبتدي بستيشن 5 بس عشان لسه مش ريدي ليها يعني.
اوكي.
هيستوري او برزنتيشن.
المفروض دكتور اشرف عطوة النهارده بمناسبة يعني وجوده معانا يعمل حالة يعني نحتفل بيه النهارده.
نحتفل بيك يا باشا. خلي الشباب يشتغل.
دكتورة حنان عثمان برضو يعني عايز كل الناس والله تشترك يعني كل الناس تشير يعني.
إن شاء الله دكتور.
دكتور مشابر is going to the exam I think next May. دكتور مشابر.
Yes, doctor, next May, inshallah, 26 or 25.
Irish, huh? MRCB Irish. Yes, Dr. Mushabir, Irish or UK?
This is Irish. It will be in Jeddah.
I think Irish is the same like different. The difference is that Irish has two big stations, 20 minutes.
Yes, two locations like MRCB UK is taking. And the short cases.
20 minutes.
Yes, and things are same, like the two cases like extended, you can say extended like station 5. This is 2 minutes history taking, and after that 8-minute examination. CNS. What to do? For the MRCB, you can see this and this too.
Dr. Mushabir, I'm sorry about your voice is so loud and there is a lot of echo. Okay, we can start. We can start now.
Okay, Dr. Sir.
Okay.
Hello, I'm Dr. Well from the medical department. You are Mr. Jack, that's right?
Yes, doctor.
Yes. Today I'm coming to discuss about your condition. Can you tell me what do you know about your condition, Mr. Jack?
Yes, doctor. I have been complaining of dry cough and the shortness of breath for the last 1 week, doctor.
For the last week, Mr. Jack?
Yes, doctor.
Okay. I know that you have a chicken pox before 2 weeks, and you were cured from this. That's right, Mr. Jack?
Yes, doctor.
Yes. Now, tell me more about your cough. Is it the same all the day, or you notice any variation between night and day? Is it any diurnal variation?
No, it is all the day with me, doctor.
Okay. And it is from the start, you feel that it's increasing, or it is the same? It has the same course?
No, it's increasing, doctor.
It's increasing. I'm sorry for that. And this, you notice anything that increase your cough or relieve your cough?
No, I'm not sure about that, doctor.
Okay. And your cough starts all of a sudden since 1 week?
Yes, doctor.
Okay. And this cough, you told me it is associated with that your breath, you feel your breath is short. Is that right?
Yes, yes, doctor.
Okay. You haven't before felt this shortness of breath before that cough?
No, it is associated with the cough, doctor, the shortness of breath.
And this is increased by night, or it is the same all the day?
No, it is with exercise only, doctor. No, with exertion.
With exertion, and while you are rest, you don't feel shortness of breath?
Yes, doctor.
Okay. Did you sometimes wake up from your sleep at night with shortness of breath?
No, doctor.
Okay. You feel that only exercise which increase your shortness of breath?
Yes, even walking, doctor, you know, increases the shortness of breath.
Oh. Okay. And when you at rest, you feel that you are relieved, no shortness of breath?
Yes, doctor.
Okay. And for how long this shortness of breath lasts with you?
As I'm doing any job, doctor, I feel this shortness of breath.
Okay. Okay. Did you notice any chest pain during the shortness of breath?
No.
Okay. Or any fever during the last week?
Fever? Sometimes, doctor, not all the time.
Okay. And this fever, it comes at night or in the morning, or what? No, or
more at the night, doctor.
More at the night. Okay. And did you take medication for this fever?
No, doctor.
Okay. Did you notice any awareness of your heartbeats?
No.
Okay. Did you notice any anything like tummy pain?
No, doctor.
And what about your waterworks?
What about it?
Is it okay? It is okay? No problem in your waterworks? Okay. And about the back passages, is it okay?
What in my back passage, doctor?
Did you notice any change in your back passages?
The amount, the color, what do you want to get? The amount or
The
the color?
the amount or the color?
No change, doctor.
Okay. Did you notice any joint pain?
No.
No, any joint pain?
No.
Any skin rashes?
No.
Did you feel any numbness or tingling on your hands or legs?
No.
Okay. Did you notice any lumps or bumps in your body?
No.
Okay. Okay. Did you notice any that you are becoming tired easily?
Yes, doctor. I feel tiredness recently more than before. I think because of this cough and shortness of breath.
I'm sorry for that. Okay. How about your past medical history, Mr. Jack? Do you suffer from any chronic condition like diabetes, like hypertension, asthma, like this?
Never, doctor.
Never. Do you have any history of blood transfusion or previous operations like this?
No.
What about your? You're taking any regular medication?
No, doctor.
Any drug allergies?
No.
And what about your family history, Mr. Jack? It is. Do you have any similar problem in your family?
No, doctor.
Okay. Did you traveled anywhere lastly, Mr. Jack?
No, doctor.
Okay. And you are living alone, Mr. Jack?
I'm living alone, doctor.
You are not married?
No.
You are single? Okay. And what is your work, Mr. Jack?
I'm employed, doctor.
Unemployed? You are not working?
Yes, doctor.
Oh, yes. Are you a smoker, Mr. Jack?
Yes, doctor.
How many cigarettes per day?
5 cigarettes per day or maybe 10 cigarettes per day, doctor.
Okay. Did you notice that smoking increase your coughing or shortness of breath?
No, doctor. I'm smoking for the last 10 years.
For the last 10 years?
Yes.
Do you drink alcohol, Mr. Jack?
Yes, doctor. I drink, but not so much. 1 glass or 2 glasses per day, doctor.
Do you take any recreational drugs?
Recreational drugs?
Yes.
Sometimes, doctor, yes.
What can you tell me what you are taking?
I'm chilling some needles, doctor. Sometimes my friend is to alleviate our moods.
Okay. Can I ask you some private questions, Mr. Jack?
Yes, doctor.
How about your sexual relations? Do you have an outside sexual relations?
No, doctor, no.
Okay. And since when you are sharing needles, Mr. Jack?
For the last 5 years, doctor.
For the last 5 years. Okay. Okay, Mr. Jack, to summarize what you told me today, you are 32 years old, and you were complaining of dry cough and shortness of breath for the last week, and this dry cough is the same all throughout the day, and it is is associated with shortness of breath, which is increased by effort. And you noticed also there is some attacks of fever during the last week. Also, you have been cured from chicken pox 2 weeks back. And also you are a smoker, about 5 to 10 cigarettes per day, and you drink alcohol. One. Okay, can you tell me what's your concern, Mr. Jack?
I'm concerned, doctor, about this shortness of breath and cough. What could be the cause?
Okay, Mr. Jack, from what you told me, it seems that it could be this your dry cough and shortness of breath are related to a bug which entered your air passages or air pipes, and this affect your lung, and this causes this dry cough or shortness of breath. It could be related to what you have got infection, chicken pox for 2 weeks. It could be this one of the complication of your chicken pox, or it could be related, to infection because you were sharing needles with your friends, and you maybe got an infection from this, and this affect your lung. Do you follow me, Mr. Jack?
What infection can cause
Mr. Jack, you can get an infection which we called it human immunodeficiency virus, which we call HIV, from sharing needles.
Yes, doctor.
And this may affect your lung. And it is one of the presentation of this infection is by lung affection.
Do you mean that, doctor, I have AIDS?
No. HIV is different to AIDS. It's not the same.
Yes, doctor.
So we are going to run for you some investigations in the form of blood test and chest X-rays, and as soon as we got the result of your investigations, we will inform you what kind of infection you have got and cause this dry cough and shortness of breath.
Yes, doctor. You are going to admit me, doctor, or not?
I think it is better to admit you and to run for you this investigation as soon as possible.
Yes, doctor.
Okay. Do you have any other concern, Mr. Jack?
No, thank you, doctor.
Okay, thank you, Mr. Jack. Nice to see you.
Nice to meet you, doctor. Discussion with the examiner. So, what's your diagnosis and differential diagnosis for this case?
My diagnosis for this case could be I will put infection like pneumocystis carinii pneumonia on my top of differential diagnosis.
Yes.
And I could also pneumocystis carinii pneumonia. If it is approved, it will be AIDS. Yes.
You told the patient it is not AIDS. You may have HIV, but not AIDS.
He got pneumonia other than AIDS.
Yeah, but
pneumocystis carinii pneumonia, pneumocystis carinii pneumonia is one of AIDS defining complex.
Yes, so HIV, if it is complicated or one of the opportunistic infection, it is AIDS.
Yes. Okay. And could be this post-infectious chickenpox pneumonia also.
What again it is post? You mean it is varicella pneumonia? Varicella pneumonia.
Against
what against?
Varicella pneumonia is. Varicella pneumonia, I think it will follow the course of chickenpox, but there will no a period of 2 weeks for the patient to develop pneumonia. I think it will follow the same course.
You mean that there is gapping, so the patient completely cured and there is gapping, there is this against?
Yes.
Okay, so what investigation you are going to do for the patient?
I will do for him first. I will do for him a blood investigation. I will do for him a complete blood count, including ESR, CRP, and I will do for him HIV test. I will do for him also hepatitis B virus test and hepatitis C virus test. Also, I will do for him chest X-ray and. Also CT scan to the chest, and I will do for him also if HIV is positive, I do for him viral load to know his viral load.
Okay. What's the confirmatory test for pneumocystis jirovecii infection?
For the pneumocystis confirmatory test is I think this is lower silver staining by bronchial lavage and silver staining.
Okay. Thank you, doctor.
Thank you, Dr.
Dr. I think this is your first case, huh? To present.
Yes.
Okay. It's good for the first case, but you missed a lot of regarding analysis of the complaint and associated symptoms. Okay, we'll do with discussion about maybe Mr. from Dr. Wael. Dr. Faid, what do you think? Maybe Mr. from Dr. Wael. أشرف. الناس نامت ولا؟
دكتور صادق.
دكتور عماد تفضلي.
دكتور صادق. I think in analysis of the data, the doctor asked about check-up. I don't know if he asked about hemoptysis regarding shortness of breath. It didn't ask about orthopnea, paroxysmal nocturnal dizziness, lower limb swelling. Okay. I think also because the patient sharing need, it could be infective endocarditis. If the doctor asked about any skin rash or joint problem, change in
skin rash, joint pain,
black urine.
The analysis of the complaint itself, cough, is it dry cough or productive cough? Is it associated with noise or no noise
Music.
Anything related, this is cough and short suppress. You have to ask about all the symptoms of pulmonary symptoms and the cardiovascular symptoms, and then after that the infection. So, pulmonary symptoms you have to ask about cough, productive or not productive, if any coughing out blood, if there is any noisy chest, and regarding the chest cardiovascular symptoms, chest pain, racing heart beats, and leg swelling, and short suppress, he has to do good analysis for the short suppress itself. First of all, of course, duration, progression, persisting factor, and relieving factor. Is it gradual or rapid? Gradual. Is it increasing, decreasing, or the same, increasing? Is it all the time with you or coming on and off? Do you notice anything that increases cough or resist short suppress? Like exposure to smokes, dust, and pollen, and you have to mention these factors that increase short suppress: dust, pollen, smoke, perfumes. And you notice anything that decreases cough or short suppress. And short suppress itself, you have this short suppress at rest or with exertion. And if it is with exertion, after having meeting, you are feeling this short suppress because pneumocystis carniae or Jurosii, short suppress is with minimal exertion only. How many pillows you are using? Do you notice that the short suppress can awaken you from sleeping, searching for fresh air? Okay. Then ask you about your differential diagnosis. Here, for example, it is a clear case that may be associated with bacillus pneumonitis. This is our differential because it came after chickenpox. In a young patient like that, 32 years old, and had chickenpox in older age, so we have to suspect HIV infection. So you have to ask about all the risk factors for HIV infection. Regarding the number one symptoms of HIV infection, loss of weight, mouth sores, bumps or lumps in the body, lymphadenopathy, joint pain, and within the risk factors for HIV infection, surgical operations, dental procedures, blood transfusion, extramarital relationship, tattooing, piercing, sharing needles. يعني if doctor Well, didn't ask about recreational drugs. I'll not tell him about this needles, sharing needles. And this is our key in this case, actually. Then to ask about all the systemic review.
Yes, Dr. Sadiq.
Communications of HIV infection, all the systemic review will start from above downwards, symptoms, cardiovascular symptoms, all the symptoms, cardiovascular symptoms, pulmonary, we mentioned pulmonary symptoms, HIV symptoms. Dr. Ryan explored about the systemic review, but not in details here. Genitourinary, then social history, family history, medical history, and drug testing. I agree with Dr. Rael that the case is a case of HIV complicated by pneumocystis jirovecii infection. This is our differential diagnosis, first differential diagnosis, which is coming with that the history of needle sharing and chickenpox in all this old age, and shortness of breath after minimal exertion. So all of these coming with pneumocystis jirovecii of complicating HIV infection. Second differential maybe أول شوية لكن secondary varicella pneumonia after chickenpox infection. But again, is that the time gap between the chickenpox and the complete cure of the chickenpox, and after that shortness of breath. This case came in UK 2 times before. Dr. Weil did well, but regarding analysis of the complaint in proper way and exploring symptoms of HIV and risk factors for HIV infection and exploring all the systemic review for the patient. in details. What about your what about the amount, the color, is there any froze urine? لو انت عاوز تسأل عن urinary symptoms. Don't ask say that what about your back passage? What about the amount, the color, any change in the frequency of your back passage?
Okay.
Don't make it an open question.
I will ask in more details.
Yes.
Okay.
General symptoms in the form of fatigue, loss of weight, bumpus and lumpus. Part 2, you have to ask about, you asked about fatigue, you didn't ask about loss of weight, and this is one of the symptoms of HIV. So it is a case of HIV infection complicated by, complicated by pneumocystis jirovecii infection, which is AIDS defining disease actually. Any HIV infection associated with opportunistic infection, it's called AIDS. So most probably, we have to examine you and do some investigation to confirm our diagnosis. Most probably you may have HIV infection because of needle sharing, which is complicated by infection in the lungs called pneumocystis jirovecii. Or maybe infection of the lung because of your chickenpox. So what we are going to do for you now is to arrange partial blood test and imaging just to confirm our diagnosis. Then we will refer you to a specialized doctor to give you the proper treatment. Is it AIDS, doctor? It's one of our possibilities that we are going to do investigation for. Okay, any question for this case?
We could speak about consent for HIV testing.
Dr. Sadiq, please. Yes?
Yes.
Dr. Sadiq? Please, about admission, Dr. Sadiq, he said we have to admit him. We try to remove it for admission.
Yes, especially for admission. It's a case of query HIV and the pneumocystis jirovecii infection. And I think in isolation.
You should mention the consent. Consent.
أنا سامع كويس.
content for testing.
دكتورة نهى مش سامع تاني معلش.
Content.
Content.
Consent يا دكتور. Consent.
Content.
Consent.
Consent for HIV يعني.
HIV.
HIV.
Of course, HIV need consent, written consent, private consent. لكن he will not focus on the consent in this case. Not a case of يعني not a case of communication skills or support consent. لكن because you are just suspecting. لكن it's okay now he told the patient that will need your consent for HIV consent as well. I think this will increase the example. Okay, we'll shift to the next case, station 5. We want to do يعني عشان برضو نبقى عارفين it will be a case of tuberous sclerosis. عشان لو حد مش يعني not trained for tuberous sclerosis, what did anyone want to do? It's the case with skin rash and the seizures. Anyone want to do?
أي حاجة ده تصادر. Tuberous sclerosis.
كنت أشرح رجل المواقف الصعبة. طبعا.
قول يا باشا بس يعني. يلا.
Okay, Mr. Jack برضو. Jack مطلوب معنا أول النهاردة. Mr. Jack has a history of skin rash for the last 5 years, associated with seizures for the last 1 year. For your kind year. Station 5.
ماشي ماشي.
جاهز؟
شوية الأستاذ.
Tuberous sclerosis, this case not frequent in the exam. I agree with you. لكن بتيجي في UK. يعني بتيجي في UK في الأوفرسيز ما بتجيش كتير في الأوفرسيز بصراحة. لكن تتوقع أي حاجة يعني. وبعدين according to the rejection rate you can يعني you have to prepare yourself for any place all over the world.
معلش يا دكتور صادق الله يخليك، الحالة اللي فاتت ديت كانت ايه عشان ما كنتش متابع؟
كانت HIV infection يا دكتور فايد ومعاها pneumocystis جيروبساي.
ماشي.
والسكند
كان differential diagnosis بقى ولا؟
هي ده الفيروس بس
بارسيلا نيمونيا.
بارسيلا نيمونيا نيمونايتس أو بارسيلا نيمونيا. هو طبعا يعني قبل ما تخش على الحالة يعني لازم تتوقع حتى تحطها في your first differential young patient مع جاله chicken pox at this age وبعدين short suppress. فلازم نحط طبعا in our mind the HIV complicated by pneumocystis جيروبساي وبعد كده ممكن نحط البارسيلا نيمونيا. يعني ممكن نحط two differential دول before حتى قبل ما نخش الستيشن. طبعا we will not يعني enumerate other differential diagnoses, only these two differential diagnoses. We will not put other differentials. دكتورة مي she put other differential in the form of infective endocarditis as a patient is needed chilling. I agree with her in this point, but again is that there is no chest pain or racing heart piece or dark urine, no other symptoms of infective endocarditis with this patient, so I think it is away from our differential.
دكتور كان ينفع pulmonary hypertension؟
Pulmonary hypertension, primary or secondary?
secondary للrecreational drugs اللي بياخدها أو للHIV.
مش عارف يا دكتور، انا ما اعتقدش برضه نحطها as differential. can be لكن يعني برضه
That's a fever.
هو الأجانست الفيفر.
nocturnal fever.
طبعا. هي
Short duration.
fever. يعني نايت فيفر اكتر مع التيوب كده ولا ممكن ولا هي بتبقى فعلا نايت فيفر
can be without fever and can be with fever.
No, I'm asking night fever.
كويس دكتور صادق وين start
night fever ممكن يجي مع HIV infection يا دكتور نهى، يعني حتى without pneumocystis cerebrosai. ماشي يا دكتور أشرف اتفضل.
Good morning.
Good morning, doctor.
I'm Dr. Ashraf. I'm senior house officer with the medical clinic. Are you Mr. Jack?
Yes, doctor.
Nice to meet you.
Nice to meet you, doctor.
Mr. Jack, I've received a letter from UGB telling me that you are complaining of skin rash. Would you tell me more about this problem, please?
I have this skin rash, doctor, for the last 5 years. And I'm complaining of shaking of my body for the last 1 year as well.
I'm sorry for that, Mr. Jack. Can you show me where exactly this skin rash?
Yeah, this rash in my face, doctor. In my tummy, and also in my back, lower back, doctor.
I'm sorry for that, Mr. Jack. Tell me, Mr. Jack, is it painful?
No.
Do you notice it is hypopigmented or hyperpigmented?
Some of them hyper and some of them hypo, doctor.
Yeah. Is it scaly, Mr. Jack?
Some of them are scaly, doctor.
Did you notice any of these skin rash around the hairlines or at the back of your ears?
No.
Is it blanching? If you press one of them, the color changes or fades away?
No, doctor.
And what about the skin surrounding this rash? Is there any change in the redness, I mean?
No.
Did you notice anything increases this rash or affects its distribution?
Like what, doctor?
I mean the sun exposure?
No.
Sun exposure, I think. Or stress?
No, doctor.
And did you notice anything improve this rash or makes fade away?
Nothing improving it, doctor.
And since 5 years it's the same or increasing?
No, increasing, doctor.
Decreasing. Increasing. And is there any associated needed changes with this rash?
Yes, doctor, there's some needed changes.
Like what? Tell me more about this needed changes.
You know, my nails became more sticky than before.
Sticky. There is, no masses in your sides of your fingers.
Some projections
Yes,
are normal projection.
I can see it. Yes, I suppose when the patient completes skin rash, I will go to examine the rash. I see it in my eyes. Right,
Yes,
Dr. Sada?
Yes, there is
And
rash
the
on the
examination, and those examination instantly I do examination.
face. Yeah.
Yeah. So tell me the distribution. You told me in the face and the
Yeah,
tummy
there
and
is
the
a
back,
rash in the
and
face.
there is nail.
There's
Yeah.
also in the tummy, hypopigmented, and some cafe au lait
Yes.
spots as well in the tummy. There is also greenish brown and brownish and taking the plaques on the back.
Yes. And the nails they told me there's a projections in the nails.
Yes, deformed nails with some projections.
Yeah. Yes, I'm sorry for that, Mr. And also, the GP told me that you got seizures. Would you tell me more about this, please?
Yes, I have this checking of my body, doctor, from time to time, doctor.
Yes. Did you lose consciousness during this checking?
Yes, doctor.
Involves which parts of your body, or takes the whole of your body? I'm sorry for that, Mr. Jack. And you sought more medical advice about this shaking body?
No, doctor.
Mr. Jack, how old are you? Told me how old is he?
25.
25. What's your job, Mr. Jack?
Yes, I'm a student, doctor.
In what grade? What level?
I'm in the college, doctor. College of Commerce. In the
And
first year.
And you are doing well in your college?
No, doctor, I'm retarded. I'm now 25, and I'm still in the first year.
I'm sorry for that, Mr. Jack. I'm sorry. Mr. Jack, did any one of your family members have a similar condition?
I'm not sure about that, doctor. My father died while I was young. I didn't know why he was died.
I'm sorry for that, Mr. Jack. I'm sorry for that. Mr. Jack, what about your motor work and regarding the amount of motor work, the color?
It's okay, doctor. It's normal.
It's not rosy at all?
No.
If this condition affects your daily activities, Mr. Jack?
Yes, doctor. I feel shy between my colleagues because of this skin rash, and also because of this checking from time to time. I can develop this checking of my body between my colleagues.
I appreciate your feeling, Mr. Jack. I'm sorry for that. And what about your mood?
I have bad mood, doctor, because of this skin rash.
I'm sorry for that, but still feel that the life is worth for you.
What?
Do you still feel that life is worthy for you?
Yes, doctor. Yes, I'm interested in life, and I want to manage this problem, doctor. I'm trying to look at that.
It's good, Mr. Jack. It's good. It's good. Mr. Jack, what about your health otherwise? Do you have any long-lasting disease like high blood pressure?
No.
High blood sugar?
No.
Have you ever been hospitalized before?
What, doctor?
Have you ever been hospitalized? Have you been admitted to hospital before?
No, doctor, just the checking, and it is spontaneous relief, and then I go on my life.
I'm sorry, Mr. Jack. I'm sorry for that. Okay, Mr. Jack. We already did examination.
What examination you want to do?
To the skin rash and the needle changes.
Okay.
I will check for the rash, the size, the distribution, the nails, and also check from the discussion with him. I noticed that he is a little bit retarded, as he mentioned, and I will do the general examination in the form of hemodynamics. There's no more examination I have to do with this skin rash. Okay.
Any other systemic examination you want to do?
Okay, Mr. Jack. I can study the heart, his lungs, and his tummy for any what's I can't remember. Okay, Mr. Sir. Okay. Do you have any drug list, Mr. Jack?
No, doctor.
Okay. Well, will you tell me more about your concern today?
Yes, I'm concerned about this skin rash and the seizures. Doctor, what could be the cause?
Actually, after examination and listening to your story, Mr. Jack, a disease is called tuberous sclerosis. And did you hear about this before?
No, doctor.
This is a hereditary disease which affects the multiple organs in our body, including the brain, the skin, and sometimes the kidneys. And it's familial. It can be inherited. So we'll run some tests, some blood tests, and some investigation to confirm our diagnosis, and we'll prescribe you to refer you to the multidisciplinary team to determine the plan of the management, Mr. Jack.
Yes.
Would you mind this?
Yes, doctor. I have one kid, doctor. He has possibility to have the disease.
Do you have any other concern? One kid, is it normal? Is he normal? I'm sorry, is he normal?
He's okay, doctor, but I'm afraid he has any possibility to have the disease, doctor?
Actually, I'm not sure about the mode of inheritance. I think it is autosomal recessive. This means that this offspring will have dominant. I'm not sure.
Dominant, yes.
Autosomal dominant, so he has possibility of 50% to have the disease.
Yes.
What's your findings in this case, doctor?
My finding, the skin rash is the typical what's called the ash leaf rash, and the new projection, which is pre-angular fibroma, was matching with the patient tuberous sclerosis, and also with the mental retardation, the patient complete of this matching with the diagnosis of tuberous sclerosis.
Okay, so what's the treatment for this case?
The treatment will be supportive. There is no cure of this condition. no definitive treatment, but we'll do a multidisciplinary team, including the derma doctor, the skin doctor, the brain doctor or the neurologist, and the social worker, the psychiatrist doctor, to put a proper plan of management for this patient.
Okay, what other systems involved in tuberous sclerosis?
The skin, the brain, the kidneys, the nails. That's what I remember now, Dr. Saad.
Okay. I know it is unusual case to rush. Okay.
Yeah, this is very difficult case, بصراحة.
Yeah. The unusual thing and most of the candidates not reading the case.
You trapped me, Dr. Saad. Yes.
No, but you did very
Yes,
well.
you trapped me.
Regarding the health of the complaint. Yes, and regarding the systemic review of the brain, or the mental involvement or neurological involvement in the form of epilepsy, low intelligence.
Yes.
But there is other systemic involvement also in tuberous sclerosis.
I know there is defect in this, but yes.
From about the borders, I feel the eyes. Okay, we finished the brain already. The brain in the form of epilepsy, mental retardation, or low intelligence. Eyes, retinal hamartomas, so you have to ask about any eye problem, any eye pain or visual disturbance. ننزل تحت شوية الهارت عندهم cardiac rhabdomyomas, so we'll ask about any heart, any chest pain, racing heart, beat, shortness of breath, leg swelling. اللانجز بيبقى عندهم lung cysts، فبالتالي بيبقى عندهم pneumothorax وهايبربليزيا. هنسأل عن الكف والكافينج اب بلاد والشيست بين عشان pneumothorax والشيست بين we asked already before for the heart. الكدنس بقى عندهم renal hamartomas، فبالتالي نسأل عن you asked already about the water work, the amount, the color for urine. البول بيبقى عندهم bone cyst وsclerotic changes, so we can ask about any bone pain or fracture. الابدومين بيبقى عندهم polyps in the stomach and the intestine and the colon. We can ask about tummy pain, getting sick, feeling sick, or loose motions or less motions, and GIP symptoms. That's all regarding ممكن يبقى عندهم بشر برضه aortic aneurysm أو carotid intracranial arteries aneurysm. need يعني for vascular to ask.
But Dr. Salah, do you think that they may do you think that they may bring the patient like that in the station party?
Yes, in UK Dr. Ashraf بيجي في UK tuberous sclerosis. Not frequent.
أنا بفكر أروح UK يا عم ما تعقدنيش بقى.
بقول لك يعني we have to consider يعني anyone can go to UK with this injection. فبالتالي we have to consider.
هو فعلا. Yeah. Yes. فعلا قالوا لي في UK any case may come, any case.
بتيجي tuberous sclerosis ونيوروفيبروماتوز بتيجي في UK. احنا طبعا neglecting these cases in upper seas عشان ما يجيش lower seas. لكن برضه we have to put in our mind. يبقى الثاني again the skin rashes أو the skin changes coming in tuberous sclerosis بيبقى عندهم adenoma sebation. adenoma sebation ده بيبقى عبارة عن butterfly rash أو butterfly distribution of the face, nodules and babules in butterfly distribution، لكن بيبقى sparing the nasolabial involving the nasolabial fold. الباترفلاي ريش بيبقى في الاس دي بيبقى sparing nasolabial fold، لكن هنا involving nasolabial fold. adenoma sebation في الفيس. يبقى عندهم بري انجل فايبروماز زي ما الدكتور اشرف سيد، تبقى عباره عن finger changes او finger projections abnormal اللي هو knee changes. بيبقى عندهم شجر باتشز. الشجر باتشز دي بتبقى عباره عن جرينيش وبراونش ثيكنيد بليكس موجوده في اللامبو ساكرال ريجون، شجرين باتشز. بقى عندهم اشليف ماكيولز تبقى هايبوبيجمنتد باتشز. اشليف ماكيولز دي هايبوبيجمنتد باتشز موجوده في الابدومن. بقى عندهم كافي اولي سبوتس اللي هو هايبر بيجمنتد سبوتس. دول الفايف سكيني تشينجز موجودين في الادينوما في التوبرس سكليروزس. وبعد كده السيستميك اذر سيستميك انفولفمنت تيوبرس سكليروزس هنبتدي من فوق لتحت. المنتال البرين عندهم منتال ريتارديشن او لو انتليجنس وبيليبسي. الايز تبقى عندهم ريتينال هامرتوماس. الهارت تبقى عندهم كاردياك رابدوماينوماس. اللانجز تبقى عندهم لانج سيستس. الكدنس بقى عندهم رينال هامرتوماس. البونز بقى عندهم بون سيستس. الابدومين بقى عندهم اكستاينال بوليبس وستومك والانسبينال بوليبس وهيباتيك انجيو ميلوبايوما. that's all يعني. فبالتالي systemic review برضه important to review this case. دكتور أشرف did very well regarding the skin analysis of the skin rash and mental analysis. But الeye والheart والlungs والkidney والbone والabdomen has to be mentioned or asked about the systemic review. Regarding the most probably you have a case the condition called tuberous sclerosis, which is a multi-system disease runs in families involving the skin and the other system, including the brain, the eyes, the heart, the kidneys, and lungs, the bones as well. So what we are going to do for you is to do for you partial blood test and imaging, and to refer you to a multidisciplinary team to give you the proper treatment. Treatment will be in the form of non-pharmacological and pharmacological, patient education, counseling, genetic testing, and psychosocial support. And the pharmacological treatment, يعني ممكن anti-epileptic treatment and the other multidisciplinary treatment, including internist, skin physician, neurologist, ايه تاني كارديوفاسكولار دكتور او كارديولوجيست بالمونولوجيست كدني دكتور، كل بقى ايه السيستمز.
عايز كل التخصصات اللي توصل.
ده عايز كل التخصصات دكتور اشرف.
Yes. Very tough piece.
مش طف والله، نوت طف ولا حاجه.
Thank you دكتور صادق.
لو جبناه من فوق لتحت هنجيبها اخرها يعني. هو كل السيستم انفولفد، فبالتالي النوت يعني مفيش تريتمنت يعني فارماكولوجيكال ولا فارماكولوجيكال، وفارماكولوجيكال مفيش حاجه تديها له، ممكن انتي ابليبتيك تريتمنت بس.
Yes.
لكن بس هو يعني لو anyone going to UK to see cases of tuberous sclerosis عشان لما يشوفها يعرف ان دي tuberous sclerosis خلاص، لان احنا ما نشوفش الحالات دي كتير.
هنشوفها فين دي؟
نشوفها ممكن تشوفها بقى على
هنشوفها فين يا دكتور؟
جوجل بيكتشرز
على النت بقى.
على جوجل بيكتشرز.
ايوه على النت.
طبعا regarding examination زي ما الدكتور اشرف عمل examine the skin rash, all the skin rash in the body اللي هو 5 skin rashes موجودين. ممكن كمان نشوف الايز to ask the examiner I'd like to do fundoscopy for the patient. Of course he will not give you permission. Put your cystoscope in the abdomen in the heart علشان نربطه الكاردياك رابدومايلوما, and on the lung fellows علشان اللung cysts. I'd like to do abdominal examination for the patient. He will not give you permission. before the systemic review related to the sclerosis. Investigation may be in the form of many mental score برضه has to be checked for this patient, many mental score for collisions. And CT brain, echocardiography, ECG, chest X-ray, and maybe abdominal CT. All investigation related to the complication or the systemic review related to the patient. Urine analysis and abdominal ultrasound for kidneys also. That's all. يعني حالة شبيهة للنيوروفيرماتوز. The neurofibromatosis also has systemic, a lot of systemic involvement also in neurofibromatosis. That's all for tuberous sclerosis. Any comment?
Thank you, Dr. Saad.
شكرا دكتور صادق.
إن شاء الله ونشوفكم على خير بإذن الله.
Thank you, Dr. صادق.
السلام عليكم ورحمة الله.
السلام عليكم.
شكرا جزيلا.
مع السلامة.